Good morning, Ann.
Good morning.
How's your summer?
Great.
Good.
Fantastic. Yours?
Great.
Good.
Good.
Very good.
Flying by. I think I speak for everyone when we say it is flying by.
Always does.
Yeah, it is.
And so all year long, the health department makes sure we take care of our children's health. And you're in charge of all the various health services that we have. What, I guess, are children's health services?
Well, I provide support to like our early childhood and family services. So there's 4 programs in our community health education promotion division. And one of those is Children's Special Health Care Services.
Okay. What is Children's Special Health Care Services?
It is a program. It's through the Michigan Department of Health and Human
Okay.
Services, and it's a program throughout the entire state. And it's for children and young adults with chronic health conditions, and it can provide additional coverage. So it's not a supplemental insurance program, but it provides coverage up until 26 years old. But
Wow.
there's qualifying, there's over 2,700 diagnoses that qualify for this program.
That's a pretty long coverage.
It is.
Yeah.
It's an extensive list. So as you can see on the screen, it may help cover some costs that
Okay.
maybe primary or public health or public insurance wouldn't cover.
Yeah, and some things that, probably are very common, like allergies, asthma, ear infections. A lot of kids, I would say.
I feel like asthma is like more common now. I don't know if that's true, or maybe people are over-treating it. I don't know.
Diabetes,
Yeah,
yeah, and younger children.
Really?
Yep.
Wow.
interesting.
And so all those things that are associated with the care and treatment of a child with any one of those conditions, like if there's medications or devices like hearing aids, that potentially is covered through the health department?
Possibly, yeah, there could be some assistance with that. So families and young children enrolled in this program, we have public health nurses. We do plans of care, talk to them about disease progression. We do transition planning as they get into their young adult years. What does their care look like? And are they understanding, what their needs are going to be as they move forward into adulthood?
How do you find out if you're eligible to participate?
Sure. You have to see a specialist.
Okay.
So we can't work with somebody who has a diagnosis from just a primary care
Sure.
physician. So it has to be a specialist. And then it's kind of unique because families have to be invited to participate.
Okay.
Not anybody can just apply
Okay.
because that would become way too overwhelming for the state. So the way that it works is, say a child is diagnosed with asthma, they're seeing pulmonology specialist, and then we can request like the medical records from the specialist, and then those get sent to the state of Michigan, and the physicians at the state review the diagnoses, and then they determine whether or not that child is eligible for services. And if it is determined that they're eligible, the family will then be invited to
Okay.
enroll. And it's voluntary. Just like anything, people don't have to participate, but they can.
And there's no income requirements. It's not based on there's no threshold that you have to meet.
No, there are some fees that apply based on family size, and then income, some annual fees that may apply. For children in foster care or who have Medicaid, those fees are waived. But for those that do have to pay like those annual dues, there's a sliding scale that's available.
Yeah.
Define children,
Yeah.
how old? What's the age range?
Birth to 26. And there are a few lifelong diagnoses, so bleeding disorders, sickle cell, and cystic fibrosis. So those diagnoses are lifetime eligible. So we do have some older adults who are enrolled in Children's Special Health Care Services.
I guess I can't make fun of some of the guys here for still seeing their pediatrician.
Well, we've got people under 25 here.
We've got kids.
There's children.
Yeah, Austin just celebrated his 24th birthday.
He's a child.
He's a child.
So if you're not old enough to rent a car,
Pretty much, yeah.
You're eligible for
Pretty much,
children's
yeah.
health.
That's about right.
Yeah,
That's
possibly.
about right.
Yes, yep.
How does, and then, so that you start as a child, you could become a young adult and still be covered.
Yes.
The services that could potentially be offered are awesome. I mean, you think about, I just look at care coordination and how much is involved with that. I mean, these people that are invited, this is awesome for them. I mean, this is unbelievable,
yes, really. It's a wonderful program, and the staff at our health department do an amazing job. And very caring, very kind, very knowledgeable, and really want to provide support to these families.
So it's summer, kids are off school, there are going to be families with kids starting school for the very first time. It's the time right now to get all those immunizations and I guess physicals, checkups, everything you need before going back to school.
Yes, that's always important.
And I know the health department will be at a lot of the back to school first days and all that over at JPS. So you'll get to see the health department out and about in the community very soon.
Yeah, get vaccinated. In fact, today it's being reported that the U.S. has nearly 1,300 cases of measles, and we thought this was eradicated 20
I
years
don't
ago.
talk about measles on the show.
I'm not talking about measles, but
I refuse.
measles, we thought they were gone. They're not, because people aren't getting their kids vaccinated.
Well, I don't think I can get measles. Can I?
No, you were vaccinated.
As a kid,
child,
the measles
as
vaccine.
every
Have you ever
child.
had measles?
As
No.
every child should. According to Bridge, Michigan, the percentage of parents seeking waivers for vaccinations for religious or other reasons has nearly doubled in the last 4 years.
Interesting.
So, yeah. But you can get vaccinations. The health department, you do vaccinations.
Yes, we do. Yep.
Okay. All right, so if you're interested in any of these services, consult your regular doctor first, or talk to you guys?
Always go to your primary
Always,
doctor
yeah.
initially, yes. But anybody who is interested in learning more about Children's Special Health Care Services, they can call that number at the bottom of the screen, 517-788-4422.
And thanks for coming back and being with us today.
Thank you for having
Ann.
me, yes.
Ann McClure, Community Health Coordinator with the Jackson County Health Department. More of the morning show after this.